Hey, welcome everyone to Homeless in San Diego. My name is Greg Angel. Happy to host the show today. And I am joined by not one, not two, but three amazing guests. Return podcast guest Nicole Pratt from our addiction focused homeless outreach team. Welcome back, Nicole.
Thank you for having me.
So you just did an episode and it was so much fun. You had to come back.
Absolutely.
super thankful for you to return.
Mhm.
And today we're talking about street medicine, and we're joined by two of our colleagues and our partners in good, Saul Quinn and Ana Chavez. Thank you both so much for joining us.
Thank you for
Thank
having
you.
us.
Thank you for having
Um,
us.
So, can you share with our listeners about your roles? What do you do at Neighborhood Healthcare? And then we'll talk a little bit about what is street medicine. That's going to be the focus for today.
You want to start?
Sure. I'm Anna. I work at Neighborhood Healthcare. I started off as an MA, then was
What's an MA?
medical assistant
Okay.
in our brick and mortar in a building, and then seen the position for a peer support specialist. Was wondering what is harm reduction. Read a little bit more into it, and then seen that what stood out to me the most was said that helps people achieve sobriety and maintain it and believe that it is possible. I was like, hey, that's up my alley because
Yeah.
I am a recovering addict going on 5 years. No, already 5 years.
Mm.
So that was that. And came to Interfaith because my office was here, met Mr. Sergio, everybody from the homeless outreach team, made good connection, got going, started doing harm reduction. Then we seen the need for people needed medical attention. So that's where street medicine came in. But my role as a peer support specialist then was just to hand out like Narcan, clean needles, meeting people where they were at. And if they wanted to get into rehab, we had the connection with you guys, with Interfaith, and made some calls and was blowing up people's phones every 5 minutes. Every 5 minutes, like, hey, I need this or that, or vice versa. And that's how we got started off. And that is what we do.
What Before Saul, you share about your role, I want to share for our listeners a little bit about the partnership between Neighborhood Healthcare and Interfaith Community Services. Interfaith, we're all recording this at our 550 West Washington Escondido headquarters. We've been in this location almost 25 years now. And for the last 6 years, we've been so fortunate to have a health clinic operated by Neighborhood Healthcare. And so Neighborhood Healthcare, you all have you're able to provide direct medical care services here. And Anna, you were sharing about your role as a medical assistant in those services here at our clinic. So if somebody comes here for food assistance and they need to access medical care, they can connect with Neighborhood. If somebody comes here for medical care through Neighborhood, but they need food assistance or they're interested in our treatment programs or our rental assistance programs or other things that we provide, we're able to connect and provide that really like holistic care for the individuals and the families who we're serving. Anna, how long were you working here in the clinic at this location?
I was actually on Elm, but
Okay.
I have came across and helped Christina Shokri, which is
Yeah.
NP here.
Our nurse
They do a
practitioner,
lot.
right?
Yes, they do a lot of referrals to us through the SDOH.
Okay.
So that's how we connect our services with you guys. But my office was in here, and we have an amazing doctor, Dr. Tantod. He's out of Elm. I had the golden ticket to double book and triple book him for our patients that Nicole or Sergio needed for us to get in there as well. Part of neighborhood, but that was what part of our connection with that for medical clearances, for just physicals that they need while they're in the program if Miss Shokri's already booked. So it was just a lot.
All hands on deck.
All
a
hands
team
on deck.
effort.
Yes, team effort.
All right.
An
Both
amazing.
organizations, multiple locations, different
Yes.
teams, right?
Yes, and if we can't see you here, we're gonna send you to Elm or Uber you to San Marcos, just to get your medical clearance or whatever it is that you need.
Awesome.
Yeah.
All right. Well, thank you, Anna. All right,
Sure.
so sorry to keep you waiting,
No
but
worries.
love to hear your role in these amazing services.
So I'm a medical assistant. I started at Neighborhood Healthcare as a medical assistant. I am now considered a street medicine medical assistant. So my role in street medicine is just like a regular medical assistant is treat every patient out in the streets instead of in the clinic. So just do everything we do in the clinic out in the streets.
And so how long has the street medicine team been working out on the streets of Escondido through Neighborhood Healthcare?
The street medicine started, I believe, the beginning of summer.
Summer here.
summer last
It's
year.
Okay.
So I could say I'm the first street medicine MA for neighborhood
All
healthcare.
right.
So we've been at it ever since last summer.
Yeah. So we're talking not a long time,
Yeah.
6, 7, 8 months.
Yeah, about 6 to 8
Um,
months.
and so, can you share about how many people you're working with and what are some of the most common medical conditions that you're helping with out on the streets here in Escondido?
We work with a bunch of people, but it's just hard to like locate a few of our patients. On a weekly basis, we see about 10 to 12, 15 patients. Um, but throughout, since we first started, we have about like
60 to 70.
60, 70 established patients with street medicine. Um, yeah.
And so, do you have a doctor who goes out with you? Can you share a little bit about how those services are provided outside of a traditional clinic setting, but
We have
actually on the streets?
we have a physician's assistant that goes out,
Mm-hmm.
and they have they work in the clinic afterwards. So we
Mhm.
even have space, a schedule allotted for patients. If we can't find them, they decide to go to the clinic. They'll be seen there. But it's 4 days a week that she goes out.
Yeah, we go 4 days a week. We see our schedule is based on like goes mornings we do street medicine, treat patients out in the field, and in the afternoon she has a panel as well. But she does have, like she said, like Anna said, she has allocated slots for street medicine patients that need to be seen in clinic.
So it's both, right? You're
Both.
Yeah.
seeing people out on the streets and also bringing people in. Um, Nicole, thinking about your role on our homeless outreach team, um, how how does the homeless outreach team and the neighborhood healthcare street medicine team, how do those work together?
Yeah, my focus as an outreach SUD counselor is getting them into treatment. Um, and we just did an amazing podcast about that last week, more about our detox program. But what is really beneficial is when I'm out on the streets and an individual maybe has open wounds that need to be addressed prior to coming into a community setting, I'm able to then call Anna or Saul, give them my location, let them know the patient that I'm interested that needs services, and they're often able to come out and treat the patient right there. So then we could then bring them into the program. There's also really good collaboration, like, um, for example, withdrawing from alcohol, benzos, or even opiates could be very dangerous.
Mm-hmm.
And it depends on their prior medical conditions. And so collaborating with medical personnel is really important for the overall safety of the person that I'm serving. And so I'll call them when I have an individual who may not have a phone, they don't have transportation, and then they're able to either come see them on the street or schedule them in the clinic where outreach team will then be able to transport them there.
So it's really, again, going back to earlier, I was describing the holistic services that neighborhood healthcare and interfaith work together to provide here within our Escondido location. We're talking about those same types of holistic services out in the community, literally on the streets. And so when you say street medicine team, that's
Yeah.
exactly what's happening.
Yeah, we're gonna treat you where you're at.
It's exactly on the
On the
sidewalk.
on the sidewalk, we're gonna draw your blood sitting on a bucket or the stools that they bring out now.
Yeah.
So yeah.
Make our own tables, get the shopping carts, flip them over, make our own exam tables right there and then. We don't have time to waste. We need to treat
Yeah.
these patients right there and then, because who knows? Maybe we'll see them today, maybe tomorrow, but we won't be able to find them next week. So that's what we do.
Yeah.
Go ahead, Anna.
Oh, and also, I was cross-trained to do MAT intakes as well, which is the medically assisted treatment. So, like, if she has a patient that needs that Suboxone, that needs that, what is it, the Librium, I'm able to do it on the street and to get the questions, have them sign even the ROIs, what is that, the agreement for treatment,
Mhm.
and draw blood right then and there to get them in.
So a lot of our work is around lowering and eliminating barriers
Barriers.
to these
Yeah.
things. And, our listeners probably understand this already, but just to say it and to be clear, overcoming homelessness is really hard. There's
Yes.
all these barriers in the
Mhm.
way, right?
Mhm.
Like people may think, oh, well, yeah, if somebody doesn't have an ID, It's hard to get a job. It's impossible to get a place to live, right? These are barriers that we help overcome. If you don't have an ID, you need a birth certificate to get an ID. Who has their birth certificate? Not a lot
Right.
of people, right? Especially if they're on the streets. So we help people overcome those barriers. But I think many people may not consider the barriers that are there to accessing medical treatment. And what you all are describing is a person focused effort to meet people where they're at, provide basic medical services, but then also to go much farther. So what you're describing, Anna, is actually providing the medication to help someone, what you were mentioning, Nicole, to withdraw safely from alcohol, opioids, benzos. Often takes medication to assist with that. And that's what you're describing, Anna, is qualifying people, enrolling them in those services so that they can begin that process of withdrawal management, and then lowering that barrier to getting into a treatment program and other things that could be even more impactful long term.
Also, the street med was made for patients that we would see them and we would book them appointments, but appointment after appointment, they wouldn't come because either their stuff was going to get stolen or people were going to look at them funny because you know, they're just, like not clean or don't have shoes or whatever. So they wouldn't want to come to the clinic. So
There's shame.
yeah,
There's
because
shame
of that
involved.
stigma or that people like, you see somebody that's disheveled and you look at them funny, and that right there already is going to break the relationship that we're already built you up. We made you the appointment. Let's get you Ubered.
Mm-hmm.
They walk in,
Mm-hmm.
they're looked at funny, and they get treated like faceless people anyways every day.
Yeah. Yeah.
So this program has made it to where, hey, you remember my name. We're bringing humanity back into them, not just treating them. We're like, like, hey, how you doing? Tapping on the shoulder, giving some people hugs, because when's the last time they were hugged? When's the last time they were actually touched or being treated like humans again? It's just goes above and beyond just treating them. It's like reminding them how important they are and that they're valued as human beings as well.
Yeah, I mean, on that topic, I feel like it's not even just a street medicine team. We're a street medicine family. All of our patients end up being like our family, that we're checking up on, and we built those relationships to where they trust us, and they're excited to see us, and they have a smile on their face every time we pull up, and we're at that point where about like 90% of our patients are very happy to see us, and before they were not happy at all. They would just be like, I don't want your help at all. But now they see us, they like welcome us with open arms and be like, all right, help me out, you know?
It's also important that the relationship that they're building with the patients that they're serving is really important, because then when they call me to come pick somebody up for detox, they're trusting Anna and Saul to get into the car with somebody that they don't know, taking them to a place that they don't really know. They might know about interfaith, but it could be a real scary transition when you've lived in the streets for most of your life and now you're going into like a more controlled environment, a regular schedule, things like that. And so by the rapport that they're building with their patients, then allows me to come in and be able to pick up where they left off too, because they trust Anna and they trust Saul.
It's a huge change in the way that services are provided. And I think about a lot of community conversations I hear where people, well-intentioned people in the community, will just speak from a point of not understanding, not getting what people are going through who are on the streets. And they'll say, well, why don't people want help?
Yeah.
We've asked them, do you want help? And they said no. And Saul, you described, providing medical services. Initially, most people were not happy to see you, right?
Yeah.
Um, why why is that? I was about to editorialize, but you all are doing this work on the ground. So can you share a little bit about why people have those concerns initially?
I mean, some of our patients feel like we're there to just collect money.
Hmm.
We do work for neighborhood healthcare. It is a business at the end of the day. And they're like, no, you just want my information so we can get money from me and not even help me. So I feel like they feel some sort of way towards us, just because of that.
Yeah.
Also, too, a lot of these people have been lied to.
True.
A lot of that's why I tell them, if I can't come back, I'm not going to tell you I'll be back, because that distrust, you break that whole relationship. If I don't show up and I told you I was going to come, you're done. Like, especially when you're on the street, your word is you're bounded by your word. So if I can't make it out there, I'm not even going to tell you. Like, um, it's that and the trust. Like, all these people go through hardship every day. They're moved around. They're disshuffled. They're what seems like junk to us is their prized possessions. They get tossed. They don't. We go out there right after a sweep. They're not going to want to talk to us. Like, but we can help you. We could hook you up with Interfaith to get you your ID voucher again. Nope, nope, nope. It takes a couple of times because, they're hurt, they're upset, and they have every right to be. Like, throw away my milk carton, I'll be upset at you, because it took them something to get it, like, and it's just that relationship of just show up. If you're gonna tell them you're gonna show up, do it because they are your word, and that trust to build up a trust again. It's hard. It's hard being out in the street and being able to trust people. I know because I mean, I'm not sure if I could go into my personal detail, but I was homeless for a while. I
Mm.
used interface services. Like I said, I'm a recovering addict, and I'm just grateful to be here today and to be the face of those faceless people that we serve, to be the voice of the people that are out there that are unheard. And for that addict that's fighting, I'm their voice today. So
Thank you, Anna.
you're welcome.
So, yeah, thank you for the services that you're providing. Thank you both, Saul and Anna and Nicole, for working together as a team, and for sharing today with our listeners about just some of the challenges and barriers there are to getting people off the streets, and some of the strategies that you're utilizing. Are there success stories? Are there individuals whose journeys you can help share about the help our listeners kind of understand the impact of this work?
I have one that Nicole helped me with here. I can't say his name for
Sure,
privacy,
sure, sure,
patient
sure.
privacy, but we'll just call him Julio. Julio had been coming to me, trying to get into rehab, trying to get into treatment, but he had some obstacles because of his record. It said he had, what is that one that you guys don't allow?
Arson.
Arson. But it wasn't true. He finally got that cleared up, came into the program, did the 90-day treatment. Unfortunately, he was placed in a sober living that didn't work for him, left, was on the street, got a little, started using a little bit. Then when I seen him again, he's like, "Oh my God, da da da, I'm ready." Within 10 minutes, I had Nicole on the phone. He's like, "Whoa, you work fast," because we showed up, we swooped him up,
Yeah, yeah.
and long story short, 9 months. He's working at a barber shop. He's in Choices in Vista. Calls me every week to check in. He says he's thankful to both of us, and he calls us his guardian angels. I'm like, I'm not an angel, but but that one right there, it was just, whoa, you work too fast. He told both of us, like, are you serious? I'm like, we ready to get tested for COVID, and we made that happen in less than 20 minutes.
That's amazing.
And he got in, graduated from here, and yeah, I'm just very thankful, and he's very thankful.
Yeah, yeah.
Yeah.
What a great story.
Yeah, and that was the collab that Nicole was able to get on it and get him in, and that he really wanted it. He took the time to go to Vista and tell them, hey, and no, it was just possession of fireworks. That's all it was. It wasn't
Mhm.
even arson, but
Mhm.
that barrier kept coming up when he tried to get into treatment. And I told him, all right, you know what? Just Nicole's ready for you. What? And he was just shocked that, like, whoa, you're too fast. He told me, wait. And we got him in. And yeah, 9 months sober. I can't even believe it's been that long.
Wow.
So yeah.
That's a
just
great story. And I think though on the other side of that kind of the other outcome that's possible, the negative outcome of the reality that we often don't have any beds open.
Yeah.
Our detox, we talked a lot about this in our last episode. It's currently an 11-bed program, and it operates pretty much at capacity at all times. So
Mhm.
there are days where I know, Nicole, you've told me you're wondering what the point of going out and doing outreach is when there's no place to bring somebody into.
Yeah, because what I see happen all too often is I talk to them about where they're at, and I utilize motivational interviewing to try to motivate them for change. And once the light bulb clicks and they're like, okay, I'm ready.
Yeah.
And then I'm like, well, I might have something tomorrow. You could just see like the light just click in their eyes, and then they just become so defeated. And the scary reality is that I see a lot of fentanyl users. And so, with that level of desperation, they're going to go and use large amounts of fentanyl, and I might not ever see them again. I might not ever be able to give them another opportunity because the reality is that opioid overdoses are the numbers are highest in the nation. And I want to be able to go out there and encourage somebody to do change, but also support them along the way. And that's what we're able to do. And so when they come into the program, their relationship with Anna and Saul don't end there. There's like follow ups and things like that. And the same thing, like when they complete detox, even residential, or if they go to another program, the substance use outreach program with Interfaith follows that person over the course of the next year.
Hmm.
So even though they're transitioning to different programs, they're operating at more of an independent level. I'm still able to support them along the way with the team that they have at their program that they're currently at, or even the outreach team as well.
So for our listeners, an individual who's connected with an outreach, they're gonna, if they're able to successfully work through a number of different programs, they're going to work with a lot of different people and different teams. So we're talking about an outreach team, a detox program, a longer term residential treatment program, often then moving into an outpatient treatment program, a sober living. These are a lot of different places, a lot of different people. And what you're sharing is that in your role as a substance abuse outreach professional, you're able to stay connected with these individuals throughout that whole process and be a real through line.
And I feel like that's really important.
Yeah, of course.
Especially when I see them when they're street homeless and they go, Nicole, like, you know where I came from and you know how much this means to me. And they just explain how they had to fight so hard to overcome addiction
Mm.
just to be a regular part of society
Yeah.
again. And to see somebody that's a familiar face is super important to continue to encourage their growth.
Yeah. Same here with neighborhood. If they are in our MAT services, um,
Those are the medical assisted
medical assisted
treatment.
treatment,
Yeah.
yeah,
Yeah.
I'd be assigned as their peer support specialist.
Mm-hmm.
So we have that connection with them as well. Every 2 weeks, every 3 weeks, just checking in on them, just reminding them, like, hey, we're here for you. If there's anything else you need, just making sure. And if they're, so that way they don't fall through the cracks. That way nobody's left behind because, got to keep reminding you and checking in on you to, that you're on the right path and the right journey. Some of the patients that we did get into sober livings and everything, when I see them again, they're like, it's me. And I'm like, whoo, for one, I can't see that far. Plus, they look amazing. Like they're just cleaned up and
Yeah.
just
Yeah.
whoa.
Yeah.
And they give me these big hugs because they'll come here to check in with you guys, and then they'll ask for me, and I'll come out.
Yeah.
But I'm like, whoa, like I'm getting my glasses in too. That's another thing. But other than that, just seeing them like
Yeah.
look alive. That
Yeah.
that light that when you're on substances, there's like a blank stare. There's nobody. There's light. There's no light. There's people there, but they're not home. And it's just like they look vibrant, they look alive. Like it's just amazing. And we've had that. Like it's amazing that we have those patients in common, and to continue, even if they don't take our medically assisted treatment program, we still like, hey, can I bug you every 2 weeks? Is it okay if we continue to call you because so you don't fall through the crack, or if there's something that somebody might have missed, we could pick up from there.
Yeah, two things I want to highlight for our listeners. First, we're talking about the light and the awakening that happens through these programs. But to be clear, today our detox program is limited to 11 beds, and often you have to, Nicole, deal
Yeah.
with that reality of like, yeah, somebody's ready. I've been working with them
Yeah.
for so long, but how does next week sound?
Yeah.
Right, and the dangers that they could die between now and then.
Yeah.
Right. So we have secured additional funding to expand our detox beds. We've actually renovated space, and we are about to expand from 11 to 32 beds of detox.
Nice.
And the final step in that process is going before Escondido City Council, which we do on Tuesday, February 19th. Wednesday. Someday I'll learn the days of the week. Wednesday, February 19th, at at 5 p.m. If you're listening to this before that time, um, you, our listener, have an opportunity to support our request to City Council to expand these critically needed services. There are a couple ways you can support. First, you can provide a letter of support. We have a link in the show notes. You can actually do that online. It just takes, it's very quick, very easy. You can share your support through a letter. The second is you can actually come to City Council. And if you've never, to our listeners, been to a City Council meeting, they're really interesting. You get to see government in action. And so you can come and just show your support by being there. We're inviting our supporters to come and wear blue that evening. And you'll get to hear a couple of our supporters share their support. The staff of the city of Escondido are recommending that City Council approve this expansion. We went before the Escondido Planning Commission recently. They supported, they're recommending this approval. So we're very confident that, and the mayor here in Escondido has been very supportive of expanding our detox programs. And so we're very confident that we're going to get the support that we need, but we don't count any of those chickens, any of those eggs until they're hatched, right? And this is literally a life and death matter. So it is important that we get support and that we show support to get the approval that we need. So that's the first thing I wanted to share, is that we're really close to being able to expand this critical resource for Anna and Saul, for you to be able to bring more people off the streets and into our detox programs. And then the second piece that I wanted to go back to is that challenging reality that people are dying far too often.
Mhm.
Overdose deaths here in San Diego are far greater than in other communities. And every single one of these deaths is preventable. And you all are providing services through harm reduction and other strategies that are saving lives, including getting people off the streets, but also preventing people from dying. Can you all share a little bit about how those services work? And Anna.
As a, with harm reduction, we hand out Narcan, testing strips, xylazine,
And what's
fentanyl.
Narcan?
Narcan is something that helps reduce the opioid, to help if, but let's say it's fentanyl or heroin, which heroin's kind of like gone now, but it'll help reverse it. There's that new drug trank that's their xylazine. They're lacing the fentanyl with it. Narcan, it will not reduce reverse it.
It doesn't work.
It doesn't work. So people have to call 911 or start doing CPR. But we are making patients aware, people aware on the street that, hey, test your stuff. We know you're using, we're not here to stop you, like shame you, but be safe. Test your stuff, like it's up to them what they do afterwards with it if they find out it's laced. But a lot of the deaths that we're seeing, a lot of the wounds that we're seeing is that xylazine, because it's coming like a crazy monster. So we thought fentanyl was bad. This one's even worse, and it's legal, right? I think
Yeah.
it still hasn't had it's still easy to get, so people are just getting creative and lacing the fentanyl with it.
And so harm reduction services are exactly what the name says. It's to reduce the harm
Yeah.
of individuals who are using drugs and other substances.
Yes.
And as I've heard it said really powerfully from one of our counselors here, I can't help you into recovery if you're dead.
Yeah.
Like
Mhm.
there's no recovery once you're dead.
Yep.
And
Right.
so we want to keep you alive.
Keep you
We
safe.
want to help continue to show you that there are some options, although sometimes there aren't options, as we talk about the detox beds being
Yeah.
full. But there are eventually going to be places for you, and we can't help you if you're dead. So we need to keep that from happening. Here within Interfaith Community Services, we've been providing Narcan to all of our teams, not just those providing addiction treatment services, but every team throughout the agency. And we've actually prevented 20 or saved 20 individuals from potentially dying through those services just in the last couple of years.
Yeah, fun fact, one of those was a dog.
20 people plus a dog.
Plus a
Plus
dog.
a
Own
dog.
cats too.
And so I just wanted to throw some education out there, is that if somebody, you aren't sure if they're experiencing an overdose or not, if you do give them Narcan, it's not going to hurt them at all. If an infant, a child gets into the Narcan, it's not going to hurt them. The pets, it's not going to hurt them either. The only thing that it will do is if there is opiates in their system, it will temporarily get the knock it off of the receptor. And then you'd have to seek medical care after that.
Yep. So it's not going to hurt anyone, and if anything does happen where somebody does have something go wrong, or an individual does have something go wrong, if you as an individual are administering Narcan, you are exempt from any liability or any criminal action. There are
Mhm.
laws in place to make
Yes.
to really safely support anyone to administer this literal life-saving drug that can prevent overdoses among fentanyl. But Anna, as you were sharing, there is an emerging new drug which this does not work on. Just increases the urgency and the need to provide access to recovery services so that people don't face these situations, and that we can reduce deaths in our community.
Yes, and also keep in mind too, you're not going to go to jail for saving a life. You're not going to go to jail for almost dying. They don't care about that. The person. So if that person's not reacting, call like 911.
Yeah, yeah, yeah.
And
Good advice.
yeah.
So, what else do you want to share about the services, the street medicine? What have we not gotten to today?
We pretty much hit everything on the dot, you know. And it's mostly, I think, it's mostly harm reduction and interfaith. You know, we come in when we were needed, pretty much, but it's being part of the street medicine. I notice it's like a lot of harm reduction and a lot of connections with interfaith, and then we come in and provide medical services. We've talked about everything that we do out there.
Nicole, anything else you want to share with our listeners?
Yeah, I just wanted to share that if any of our listeners, if you or anybody that are that you know are struggling with addiction, oftentimes what could be very helpful and what you could do is to listen, provide a listening ear. If you are the one struggling with addiction, it's important to reach out for help. Um, there are programs like Interfaith or neighborhood healthcare. Anybody would be able to help you. If you feel like you are suicidal, you feel like you're going to hurt yourself or others, 988 is the number to the 24-hour crisis line, and they would be able to talk to you. They could even send somebody out to come and talk to you. If you are interested in detox services, the option to text is 760-203-3350.
So that's a number that someone can text and actually get access or connected with our detox program.
Correct.
What's that phone number again?
760-203-3350.
Okay. And we'll put that in the show notes too.
hmm And if you'd like to talk to somebody, maybe you just want some more information on what sobering services is for you or for somebody that you know, you could call 760-489-6380, and our receptionist is extension 193.
And that phone number is our main interfaith phone line. You can also call that if you're interested in any services that we offer. Our Office of First Impressions will answer every phone call during business hours, although sometimes we get a little busy and you might have to wait a few moments or leave a message, but we'll get back to you. And or you can also connect directly, like Nicole was sharing, with our receptionist who's focused specifically on our drug and alcohol programs. And she's available. Well, the phone number, I'll share it again, and then you can mention the extension. The phone number for the main line is 760-489-6380, and extension.
193 for sobering services.
Perfect. Thank you, Nicole.
Also, for our listeners out there, that anybody that needs any harm reduction products, like such as Narcan or anything like that, or trying to get into MAT, they could reach me directly at my work number. I do answer that daily, Monday through Friday.
Okay.
I turn it off at 4:30. So it's going to be 760-912-6389. Again, if you need Narcan or any harm reduction supplies or just any questions about our street med team, you need know someone that needs treatment or a doctor, please feel free to reach out.
Wow. So you can call Anna directly, and Anna,
Mm-hmm.
your phone number one more time.
760-912-6389.
Wow. So lots of opportunities to get resources, get support. On our last episode where we did a deeper dive into detox, our one of our lead counselors, Robert, said it so powerfully. He said, you know, it's okay to ask for help.
Yes.
We have all been helped throughout our lives. It was a doctor who helped us be born, or somebody. It was our mom or a parent or a family member or a friend who helped raise us, right? As we get older in life, we'll have to lean on other people to take care of us. Help is a part of the human condition. It's a part of who we are as people. And so if you're in a place, to our listeners, or you have a member in your life who is in a place where you are struggling with addiction and need these services, please ask for help. Our teams are here. We have other teams who can help, so reach out. We always have calls to action. We've shared a little bit today. We have the upcoming hearing with City Council, and so shared that supporters can share a letter of support, can join us at council that evening. They can come meet us. I'll be there. I don't know if Nicole, you're planning on attending,
Yes,
but we'll have
I'll
a
be
whole
there.
whole crew there, so
I'll
it'll
be
be
there.
fun. So you can join and support in that way. What are some other calls to action to our listeners who want to help?
Any drug and alcohol counselors that are seeking employment that possibly are bilingual. We've came across patients that we try to get into interfaith, and unfortunately at that time they didn't have staff, so they felt it would be a disservice to have these people come into detox because the groups are held in English. So anybody out there that's seeking employment, once this goes through, great opportunities.
Yeah, absolutely. That's a good one. We're hiring now. I met with 8 new professionals who are a part of our recovery and wellness programs who joined Interfaith just this week, and a number of them are specifically going to be supporting the new detox. We are bringing on more bilingual counselors as well. And then Nicole, we have a new translation service that's also helping to address that. But yeah, if you're listening to this and you're in the industry, and you're a registered or certified substance use disorder counselor, or you're interested in other positions, check out our website. We are hiring for those positions. And if you're interested in the field, it is a wonderful way to both make a living, make a difference, and and support a career that has a lot of upward mobility. And so we have an entire workforce development initiative here within Interfaith, supporting individuals to become registered substance use disorder counselors, to complete their education, their certification there, and then from there you can move forward into all sorts of different career paths. So calls to action are for those who may be interested in joining our teams. Other calls to action or other things you all want to share before we wrap up our episode today?
Yeah, I shared about the calls to action about, just providing a listening ear to
Yeah.
somebody. And addiction's not a choice, right? Um, you don't look at somebody that has stage 4 cancer and yell at them, "Why do you have cancer?" Right? You provide opening, like listening ears and a heart of compassion, and addiction just comes like that,
Hmm.
right? It may at first be a choice just to maybe escape or find a short term relief of some sort, but before you know it, you could be struggling with addiction. And it's important to know that addiction's non discriminatory. Doesn't matter what kind of position you hold, it doesn't matter how much money you do or don't have, it doesn't matter if you have a home or you don't have a home. I just know that people who are unsheltered have a much harder time trying to change their life from turning away from drugs and alcohol, because I often hear that they have to stay awake to watch their things throughout the night. Um, and so I just want to encourage that when we do talk to people or people that we know that struggle with addiction, just to be open minded, have a heart of compassion and just hold space and listen to what they're going through.
And this episode has been about street medicine, connecting with people who are on the streets, providing services that are really critical to help them to be as healthy as possible, to overcome health challenges, and then to get them off the streets, to get them into whether it's a detox or other type of residential program, recuperative care, right,
Mhm.
which we operate here as well. I remembered as you were describing, Nicole, that like it's so hard for people who are on the streets to overcome addiction issues, that when he was HUD secretary, Dr. Ben Carson said it directly when he was newly installed in that. This is a few years back. He said, you can't beat addiction when you're living in the gutter. You know, I share that as we're in a time where politics are crazy, right? And there's a lot of division over these things. But even amongst the polarization of politics, most people can come and agree that addiction is something that has to be addressed while you're in a housed situation. And that's what we're trying to do here. So really appreciate Saul, Anna, Nicole, the amazing life-changing work that each of you do. Thank you for taking the time to join us today. Thank you to our listeners for taking the time to learn about these services. Anything you all want to share before we wrap up today?
Thank you, and hopefully we can continue doing what we're doing, collaborating together. And thank you to my organization for allowing me to be transparent within my life, my lived experience. That's making the difference out here too. Like I get to share my story and not be ashamed of who I am within my organization, and that's amazing because when you had an addiction before in the past, you had to like nobody knew, like nobody even knew I had gone to jail. When you get hired onto somewhere, and this job that I'm in, which is a blessing, gave me the opportunity to be like, this is who I am, this is where I've been, and we're growing from there. We're making things happen, like, and it's amazing. Shout out to my organization for that. It makes me proud to be a part of it.
Well, shout out to you, Anna, for who you are, doing the work that you do. And I echo your support and kudos to Neighborhood Healthcare. It's an amazing organization, has been serving here in Escondido even longer than Interfaith, going back probably more than 50 years at this point. And we're so appreciative of the partnership to do that work together, both here within our Escondido location and out in the community. So thank you all for joining us today. Thank you to our listeners. We will join you all again soon. Have a great day, and thanks for tuning in.
Thank you.